Welcome back to Hypertension Resistant to Treatment. I am your host, Dr. Tanya. If you or someone you love has high blood pressure, you know how challenging it can be to keep those numbers under control. Medications, diet, and exercise are the foundation. But what if there was another tool, something natural and side effect free that could help lower your blood pressure? Today, we're talking about Respirate, an FDA-cleared device that helps lower blood pressure through guided breathing. So, what is it? Respirate is a small device with a sensor and headphones. When you use it, it plays musical tones that guide your breathing to slow down and deepen. As you follow along, your blood vessels relax, stress levels drop, and over time, your blood pressure can come down too. Just 15 minutes a few times a week can make a real difference, especially when added to your regular treatment plan. But don't just take my word for it. Let's hear from someone who's actually used it.
Results I got from using Respirate were astounding. Yeah, my doctor was truly astounded by the fact that I found something that works, and the results speak for themselves because the numbers, he can see the numbers when I'm in his office. More importantly, I see the numbers every day when I check my blood pressure. The blood pressure before Respirate was probably somewhere in the area of around 150/90. That's hypertension. I don't know if it's serious hypertension or not. I guess that's for doctors' guidelines as far as what they consider normal. But 150/90, maybe 150/100 is pretty high. So I go in for my annual checkups every year, and blood pressure has never been a concern of mine. I'm a marathon runner. I've run 11 marathons. I know what it's like to be in shape. And again, if there's one issue I never thought I would have is anything having to do with high blood pressure or the heart. But it was about 4 years ago that I went into the doctor, and we did the checkup, and he told me that my blood pressure was high and that I have the option of either going on meds or trying to do it on my own. I preferred not to take meds, so I tried it on my own, and I tried exercising a little bit more. Like marathon training isn't enough, but I tried exercising a little bit more. I tried listening to relaxing music. I tried a whole bunch of things as far as, calming down, working on the stress, working on trying to get that blood pressure down, eating less salt, whatever. I did everything that I possibly could. And then I went back in per his instructions about 6 months later, and the blood pressure was still high. It was somewhere in that 150/100, maybe 150/110. So they finally put me on some meds, and I tried a couple of meds over the next year or so. It lowered it a little bit, maybe 5 points or so, but not all that much. So they wanted to up the meds, and I really didn't want to do that. So I've been seeing a therapist for the last number of years when it comes to having to deal or how to deal with my stress. And she had mentioned this product from Respirate that is you put the earbuds in your ears and you listen to the music and it kind of relaxes you. And at first I was a little bit hesitant because I thought, oh, give me a break. That's voodoo medicine or whatever. But I tried it, and I found it very relaxing, and I was using it a couple of times a day for the first few weeks. My wife is a nurse, so we have a blood pressure monitor here at the house. And even with Respirate, it didn't seem like it was doing very much those first few weeks. And I was starting to lose a little patience, thinking that, maybe it would, what's going on here? I thought this is supposed to work. But my therapist said, no, give it a month or so. And after about a month, I started noticing a difference when I looked at the numbers. The blood pressure came down considerably. Probably by about 10 or 15 points. Now I've been using it for about 2 years. I check my blood pressure probably once a week. And the blood pressure this morning was 110/79. And for the most part, it's somewhere around 120/75, 120/80. And that's been fairly consistent now for about 2 years. So I'm very sold on this unit. It's just hard to believe that something like that can work so effectively Most people breathe somewhere around 15, 20 times per minute. I'm down now to like 3 breaths per minute. So I'm very sold on the product. I think a lot of people look at the cost and they're thinking, I'm not going to spend that kind of money. It's just too expensive. But I went in and bought the unit, and I decided that I'm really going to make a commitment. And now that I've been using it for 2 years, it's the best investment I've ever made in my life. Well, that might be a stretch, but there's a lot of fun things that I've bought in my life, but this is for my health. And as I've gotten older, I realized that, there's nothing more important than our health. I used to say that when I was younger, but it didn't really register because, when you're young, you're thinking you got a long life ahead. Well, I like to think I still have a long life ahead, but it's all about health. And it truly is the best investment because it forces me to relax. I listen to it twice a day. The results speak for themselves. The blood pressure is in the range of 120/70, give or take 5 or 8 points. That can vary every day, but it's always in range, and it's in a healthy range. So that's the proof is in the pudding. The proof is in the results, and I can see the results when I check the blood pressure monitor that I have at home. I see it when I'm in the doctor's office. It truly is the best investment that I've ever made in me.
When I'm asked, do I recommend Respite? Yes, I do. I recommend it to my patients. I've recommended it for my family members to use. I've used it myself. So I think it's a good product. It's effective in blood pressure management. I've been practicing in cardiology and specializing in hypertension for over 35 years. There are things that have come and gone, and none of them have had staying power. And when they've been studied effectively or used widely, still the Respite is the only non-drug, non-lifestyle change that's been effective. Patients love it when they have it. I think they embrace it for a couple of reasons. People don't like to take medications. They're looking for natural ways to treat their blood pressure. So they like the fact that it is a non-medication way of controlling their blood pressure. I was skeptical at first about its value. And then when I learned about the studies that were done, learned about the clinical experience that people had with it, and then using it, I became convinced that it works. My sons had high blood pressure, and it was an issue for them when they were involved in sports and they were interested in a military career, and that would have been a problem for them. And so with lifestyle changes and using the Respite, their blood pressure came under control and really wasn't an issue for them that created a problem with them, entering the military. One of the fundamental approaches to stress management has always been better breath control. I think that in our busy, stressful lifestyle, we somehow forget to breathe when we need to. We either don't breathe enough, or when we're under stress, we tend to breathe too much shallow breathing. The physiology of how the control of blood pressure within the central nervous system is in the automatic area of the brain, right next to controlling the heart rate and breathing. And the only one of those automatic functions, blood pressure, heart rate, and breathing, that we have conscious control over, unless you're one of the yogis from India who could slow your heart rate, would be the breathing. And so it's, I think, easy to understand that by regulated breathing, that nervous activity within the central nervous system spreads to the other areas and starts to bring those under better control. We experience that when we're under stress. We can breathe deeply and calm ourselves. So for non-medication treatments, the Respite is the one.
Hi, I'm Dr. Henry Black. I'm a clinical professor of internal medicine at the New York University School of Medicine, a member of the Center for the Prevention of Cardiovascular Disease, and currently president of the American Society of Hypertension. I want to talk to you about something that's interested me since, I would say, 1995. I was told about a device that would help individuals breathe in a certain way that we knew from many, many generations, if not millennia, that would help relax people and reduce blood pressure. Seemed like an intriguing idea in that we don't really have a good way pharmacologically to deal with the central nervous system, and we do know the integration of the sympathetic and parasympathetic nervous systems through the brain is a critical manipulator and modulator and controller of blood pressure, pulse, and other things of that type. Well, this device has come along, and I'm very happy to say that I and my colleagues on the Scientific Advisory Board and others have helped direct the evaluation program such that this device is now FDA cleared for the management of high blood pressure. So I think this is a device, in addition to other non-drug therapies or lifestyle modifications, that can make a big difference. We know salt restriction is important. We know weight loss and exercise are. And in my opinion, getting the central nervous system to function properly is a major asset. Now, I also use this device in people who are not at goal, who are on multiple medications, who just need to get closer to where they want to do. And I've used this predominantly in that arena since I get resistant patients and complicated patients. I sort of collect them. And that's one of the places I found Respirate to be extremely helpful. It's easy to use. You've heard about how to do it. Patients appreciate it. I must have at least a dozen people on it right now. All of them are pretty much following the regimen. It takes a little while to get to learn to use it. You've got to do this for about a month, at least 3 or 4 times a week. Try to get at least 40 minutes of slow breathing time. But to my surprise, initially, but not now, people are actually able to adopt to this and enjoy the experience. It's a short time a day. Even though you're doing it for 15 minutes, it works the whole day. And it seems to work in various areas as well. So I'm very excited about this possibility and think that we may, as we search around for some way to deal with the essential part of that the brain plays in elevating blood pressure and controlling heart rate, then we may have a way to do this. Appreciate your attention. Thank you very much.
Thank you for sharing your story. Respirate isn't a replacement for medication or lifestyle changes. But for many people, it's a powerful add-on that gives them more control and peace of mind. If you're interested, talk to your healthcare provider